My name is Petra Ottmann. I am a gynecologist who has been in private practice for over 20 years, and I have also been working with psychosomatic energetics for over 20 years. And I'm always thrilled. And for 20 years it has also been enthusiastically involved. What always inspires me is that I have the feeling that I am working on the causes of diseases. That I'm not just, in parentheses. But that in the case of chronic illnesses, in the case of symptoms that often cannot be explained in this way by conventional medicine. In the case of recurring illnesses, it is easy to address the causes. Because in the context of psychosomatic energetics, we are looking for precisely these causes. And the cause of most chronic diseases, of serious illnesses, be it physical, be it mental, be it due to anxiety, depression. In all these diseases, we find a lack of vital energy. And this lack of life energy, we can test it. And that's the second great thing I find about the L.Ac. And which the patients also like very much. As part of an energy check, which we carry out with the help of a test device, we can see how much potential, how much healing potential, how much healing power is available to the soul, is available to the body cells. And if we then test that this is only at 10 or 20%, for example, or even at 40%, then many patients feel noticed for the first time. They feel taken seriously for the first time. Because often the patients have already undergone many therapies and have also undergone a lot of diagnostics. And no one really finds anything, or even if you find something, the therapies don't really help. That is, the patient sees himself in this, which we then test. He recognizes himself. And the second nice thing about testing is that we can also follow the course of therapy and see, as the therapy progresses, the patient's energy levels increase. And with an increase in energy levels, the symptoms gradually disappear one after the other. This means that pain decreases, fears subside. And patients feel more stable and healthier overall. Yes, as a gynecologist, of course, many women come to me explicitly and ask, is there something wrong with their hormones? So they have a wide variety of problems in connection with menstrual cycles, pregnancy, menopause, hot flashes and sleep disorders. Sometimes vegetative disorders such as palpitations are also part of it. And who then often ask about the hormonal connection, which always exists. But the basis behind these hormonal connections often lies in the mental state. Or even in a lack of energy. And that's where I can really always provide great support, in addition to hormonal therapy, which may also be necessary from time to time. For example, I have had women who were always particularly depressed or aggressive during premenstrual syndrome, in the days before menstruation. One of them didn't want to talk to her husband anymore. She was really mad at him. Even though she knew she loved him. Nevertheless, she was always in turmoil with her husband before her menstruation, and that annoyed her herself. And from a purely hormonal point of view, something like this simply cannot be solved. Through traumas they had suffered at an early age, and we were able to solve them with the help of the L.Ac. Or another patient who had massive back problems during menopause. What you usually look for is to solve the back problems. Or you can provide hormones, but she wanted holistic treatment. And then, in the course of the treatment, it turned out that not only did the back pain go away, but the cycle also returned to normal. And then naturally, I would call it, she has gone through menopause. So there is actually no physical condition that I do not offer or that I do not like to treat with psychosomatic energetics. It comes from the fact that we treat holistically. And we treat Not only the vegetative level, not only the body level, not only the mental level, but also the hormonal level. And when all these levels are in unison, are in harmony, are in their full power, then we are dealing with healthy and as good as symptom-free patients. So the PSE can easily be applied to everything. Ultimately, there is not a symptom or disease where PSE does not have a positive and an improving influence. These can be chronic pain conditions, and especially gastrointestinal problems, irritable bowel problems, Crohn's disease, ulcerative colitis, all. Mental disorders such as depression and anxiety disorders can be wonderfully supported by psychosomatic energetics. And all the therapies that someone does, whether they do acupuncture, whether they do conventional medicine, whether they do hypnosis therapy or whatever, psychosomatic energetics supports any therapeutic approach. Brings the patient into attunement and harmony.